welcome. So hi, everybody. Good night. I am Karyn. I'm a physical therapist from Rush Physical Therapy. I am part of our ReVital training program, which is our oncology rehab program. So I'm really excited. I know this is a lot of times a very interesting topic for people to discuss. So hopefully we can provide you with a lot of information. But tonight we're here to talk about peripheral neuropathy, kind of delving into the exercise aspect of it, as well as physical therapy and some options for treatment out there for people who are suffering from peripheral neuropathy related to their oncology treatment. So like I said, my name is Karyn Holtz. I'm in the Mount Prospect location for Rush Physical Therapy. I'm a physical therapist by training, but have treated oncology patients for over 10 years, starting out with lymphedema training, and then, as I mentioned, training under our oncology rehab program. So hopefully you guys find this information interesting and informative, and we'll go through questions at the end. So I like to typically start out just as kind of a reminder for everybody. And the reminder is just that cancer is a journey. And everybody on this call today may be in different places along their treatment. They may have had different experiences. Everybody starts at different points. Everybody starts with a different baseline. So just reminding you guys and remembering that everybody does not have the same experience, and everybody might take different paths. So just know that your situation at many times is unique to you. So when we're looking at the big question is, what is peripheral neuropathy? And when we're looking at that, chemo-induced peripheral neuropathy, it describes damage to the peripheral nervous system. So what we need to understand is that's the system that transmits information between the central nervous system, which is, like, for example, our brain and our spinal cord and the rest of the body. But what happens is this neuropathy happens due to some chemotherapy agents. Traditional chemotherapy agents that are known to cause our peripheral neuropathy are our platinums, our taxanes, our vinca alkaloids, and medications. So that's like your taxanes, and platinums would be like a cisplatin and a carboplatin are some of the common names that these would go by. They're used to treat multiple different cancers, including like your testicular, ovarian, bladder, breast, head and neck cancers. So there's multiple diagnoses that can be suffering from the peripheral neuropathy. And just understanding kind of what nerves these attack can help to really help differentiate other nerve type pain that sometimes people are experiencing. So what we're looking at is our CIPN and why it's a concern. It's a common side effect affected by people with cancer. Patients typically ask themselves why it's concerning, and that's what the questions we want to answer today. So when we're looking at this, there's no sure way to prevent neuropathy from happening, but there are definitely things we can do to manage it. So that's the things we want to kind of discuss today. Sometimes these symptoms can go away after a short period of time once treatment is done, and sometimes they can last longer. They can also have different effects. So what our concerns are and why we do want to address these is, if we're looking here statistically, with neuropathies, we can see about a 2 to 3 times increased risk of falling, which obviously becomes problematic. And then looking at this, we want to kind of know what we can do to control it, since about 50% of people can have experiences that last a little bit prolonged, greater than 6 years. So knowing what we can do to control it, especially looking at like our fall risks, as well as the longevity, are some of our concerns, especially when we're looking at it from a physical therapy standpoint. So the most important thing, I think, to take away and remember from this, so there's a multitude of reasons of why you can end up with tingling and numbness in hands or feet. Many times you'll hear people who have back problem have like tingling into a foot or a leg. The thing to remember when we're talking about CIPN is that it's numbness or tingling, and to remember that it's in a stocking and glove pattern. So if we're looking at this picture here, you can see that it's typically going to affect both hands or both feet, and that it's in a stocking and glove pattern. So it's both, it could be both hands, it could be both feet. If you are experiencing something where it's one hand or one foot, that's where you want to kind of look at and discuss some of that with a physician, just to explain to them that you're having, where you're having your symptoms. But the more specific you can be with describing like this, either like stocking and glove pattern, the more it helps to definitely differential diagnose CIPN versus another sort of nerve type of pain. So here are listed some of the most common offenders when it comes to the cause of peripheral neuropathy. All of these can have effects on the nerve fibers causing the symptoms that we described, like that stocking and glove pattern. To further complicate things, risk factors exist that can make an individual more prone to these symptoms. So if we're looking at some things, we're looking at like older in age, there are biological changes that can affect nerve function, making it more susceptible to nerve damage. People who abuse alcohol can have an increased likelihood of nerve damage. And it can also slow like the transport system. We're looking at people with, an autoimmune like an HIV or an AIDS type of virus. And then our diet. We just want to make sure we're getting adequate food intake, because anything where you can have a deficiency in key nutrients can also have effects on the nerve health. So looking at this, what does this mean in terms of our ability to participate in normal life activities? And I think that's the most important thing we want to look at. Think of some examples where you would be limited with the use of your hands or your feet due to that numbness and tingling. Will the pain affect the ability to walk on an uneven surface or ambulate through a grocery store? Can you grasp items and put them in a grocery cart? So once we look at like the peripheral neuropathy, we want to see how that affects overall day-to-day function. Can you manipulate coins at a register? It can affect all ages and genders, and it can be endless. So what we want to look at, the physical therapist is looking at basically kind of our fine motor movements as well as our gross motor movements to see how you're able to manage with those symptoms. Looking at our daily activities of living. So we've seen some examples of what it looks like. So we want to also look at daily activities because it can affect both hands at the same time. Often fine motor skills can be altered. So if somebody isn't feeling and experiencing that numbness, it can lead to difficulty with like those coordinated activities, chopping, buttoning, tying shoes. So that's some examples of looking at the hands. Or those grasping of small objects, brushes, etc. So that's where we're looking at like our ADLs and our effects on that. We have also learned, and another thing to remember is that having that CIPN and that numbness in the feet can put you at a higher risk for falls. So when the feet are numb and tingling or burning, it causes the feet to be less able to tolerate changes in surfaces and react. It can also affect the ability to wear the most appropriate footwear due to pain. And all of these need to be taken into consideration when kind of treatment planning and talking through, especially when people are looking at what their goals are, as far as what their concerns are and their difficulties are. Just looking at what limits somebody is having, so we can see how to address those to help provide somebody with a little bit more function. So this is just kind of a little like kind of think through it quiz, just to kind of help people to kind of recognize if they might be having some CIPN symptoms. So, have you fallen or almost falling? Do you have a fear of falling, balance troubles? And kind of compare that to where were you prior to your oncology treatment compared to where are you now? Do you have difficulty buttoning a shirt or typing on a keyboard? You know, how is your fine motor skills? Are you dropping things because you can't feel like that coffee cup or a utensil? And then remembering that when we talk about our peripheral neuropathy, it's going to be that tingling and numbness in that stocking and glove pattern in both the hands and the feet. So kind of asking those questions, and kind of our purpose today is to really talk through like what you can do to help manage, as well as like what we do from a, like a rehab standpoint to help somebody manage, and how that type of stuff helps to assist with the symptoms of CIPN. So what we're going to do, we're going to kind of talk through a patient. So I had a patient, her name was Linda. She was diagnosed with breast cancer, and had been treated with Taxol. So if we remember, Taxol is one of our agents that is going to be neurotoxic. So meaning that that can have an effect on those nerve fibers. She began taking that in 2018. And about 1 month after taking Taxol, she began to experience symptoms. So over a 4-year period, she described worsening symptoms to her feet, with some bilateral hand symptoms as well, but most of her problems were to her feet. So she's a very typical patient who comes in. She was having trouble putting shoes on. So she was typically wearing flip-flops because any pressure across the top of her foot was causing her too much hypersensitivity and pain. So she was only able to wear flip-flops. She reported difficulty in tolerance, standing, uneven surfaces, and felt like she was going to fall. She was a little more complicated because she also had a previous total knee replacement. So, she was already at a little bit of a fall risk. She wanted to really, her main goal, was to be able to dance and wear normal shoes at her son's wedding. And so that was kind of her important goal. So looking at that, she felt like she was going to fall. She couldn't wear normal shoes, and definitely was feeling the effects of that CIPN. So when we look at somebody, we're obviously going to look, and you guys can even kind of like think through this stuff and how this applies to your own self. But what we evaluated in clinic was looking at Linda's balance. So, kind of doing a balance assessment to see like how high of a fall risk she was. We also want to look at her strength. We tactilely or touch her feet so she could feel what that feels like. Looking at her endurance, her sensation, and then just overall coordinated activities. And that's the kind of stuff we look in so we can kind of gear and put a program together that's specifically for you. So when we're looking at the treatment options for managing peripheral neuropathy, general exercise, we want to look at balance. We want to look at walking. There is some general exercise recommendations in general. There is a 150-minute moderate exercise recommendation throughout the cancer continuum, and throughout survivorship that is recommended as far as activity. So kind of keeping that in the back of your mind. That's difficult to really achieve that when you have that peripheral neuropathy symptoms, because it does affect your ability to balance and walk. So again, kind of gearing that towards each individual person. If somebody is, kind of trying to work out and do that exercise, how are we going to moderate and monitor fall risk? So, that might be something where somebody is going to like walk, but as long as they can wear good shoes. But if they're unable to, your best bet is going to be doing stuff like stationary biking, etc. So looking at balance, the best way to train balance is by practicing balance. So, even the ability to sit and hold yourself up with one foot on the ground, if you're not feeling your feet or if you're not able to wear good shoes, that's going to be a difficult task at first. So what needs to happen is to gradually progress and gradually challenge the system. If we think about when we're walking, or we're walking on those uneven surfaces, everything's in motion, or you might be moving your head because somebody calls your name. So we need to retrain your system to be able to react to those changes in either surface you're walking on or change in direction, etc. So that's ways that we can practice doing that. to help with that neuropathy. Generally, the other things that are helpful are some stretching techniques. We can use some taping techniques as well. A lot of times with the neuropathy, we want to do soft tissue massage. We're thinking of those nerves that are almost overstimulated. So by doing some soft tissue massage, you can help to reduce that hypersensitivity. And then in general, looking at activity modification. So if somebody's having a lot of difficulty with activities, how can you modify it? So for the example of somebody who has something with their hands, what you want to think about is how are you going to if you're having difficulty grabbing a fork, are there adaptive techniques or adaptive devices that you can use that's then going to better enable you to be able to hold that fork or that pen or any of those type of things if you're having difficulty buttoning. And that's a lot where occupational therapy comes in versus PT. But are there button helpers where it helps you to button a shirt? There's things like that. How are we going to modify that activity? And then again, looking at practicing our fine motor tasks of whether that's buttoning a shirt, tying shoes, opening a jar, manipulating coins, etc. That's mostly for the hands. Our biggest risk for the lower extremities is probably going to be our balance risk, especially taking into consideration multiple factors. So some even of our cancer treatments are also going to affect our bone density as well. So throwing that into the mix, balance becomes very important, especially for a multitude of reasons. So I can't kind of emphasize that part enough. So the other thing we want to also look at too is tips to promote our safety, right? So when we're thinking of that CIPN, I think probably the biggest thing we're talking about is, again, that fall risk. So when we're thinking of that, we want to also go ahead and do things to protect ourselves. So if you're thinking of your hands having a lot of that hypersensitivity, think of being super cautious with using very hot water. If you're really hypersensitive, make sure you're getting yourself a good pair of gloves. If you're somebody who cooks, make sure you're using that pot holder so you don't sustain burns. And those are all the things that are really important for our fall risks. Getting up in the middle of the night to use a bathroom, make sure your rooms are well lit. Make sure you're also going ahead and using like night lights if you have to. Trip hazards. So if we're looking at our trip hazards, look at things like loose rugs, bath mats. You really want to think of like decluttering walkways, sharp objects. So if you're having difficulty with that fine motor and feeling, you want to be super careful also with those sharp objects. So if you're using knives, making sure you're really feeling, you have a good grip on it so that you're not then cutting yourself. And then lastly is kind of coming in with our footwear. So if we're looking at our footwear, make sure you have good traction on the bottom of the shoes. Typically like a lace up or like a loafer or even like sometimes a Velcro strap can be more beneficial for somebody, especially if you're having difficulty with shoelaces. Always making sure as well, if you do have that neuropathy, when you make sure you're in good fitting shoes, and make sure that you're constantly examining your feet. So when you're looking at your feet, look for blisters, look for abrasions, anything like that can happen from that lack of sensation in the feet. And the same thing goes when we were talking about like even massaging, massaging your feet, stretching your feet. That's all stuff that can help those nerves to kind of regenerate and not be so hypersensitive. So I think those are all very beneficial when we're evaluating from a neuropathy standpoint. It's a hard thing to treat because there's not a lot of, like when we're talking about what we do in a rehabilitation standpoint, those are probably the best things when it comes to stretching, balance, retraining, and a lot of the soft tissue techniques and some of the taping are probably the things that have the most evidence-based research behind it. So sometimes when we're looking at other alternative medicine type things, that would always be something that we would recommend to discuss with your oncology care team. because sometimes there's stuff that might not be necessarily bad to do, but there's unfortunately just not a lot of the research behind it to substantiate some of the other treatments that might be out there. So basically looking at what you can do to help to minimize the symptoms, what you can do to try to exercise through, and then preventing falls and the hypersensitivity are going to be probably the things that we focus most on in a clinical standpoint. So remembering to always discuss stuff with your cancer care team when you're starting. If you're new to starting an exercise program, always kind of discuss that through with your cancer care team to make sure that they are okay with you at that point and they feel safe with having you begin an exercise program. And then really just looking at, remembering that with that CIPN, it's going to come in that stocking and glove pattern. And I think that's probably the most important thing to try to remember, because sometimes people have underlying, back issues, neck issues, carpal tunnel things, that then they're worried that that's a neuropathy thing. So we want to just make sure that it's clear that it's always that stocking and glove. It can start in the toes and then progress up a little bit into the lower leg. It could start in the fingers and then progress up a little bit towards the forearm. So just knowing how the patterns might present is also very beneficial to understanding the condition. So I think that from that standpoint, I kind of covered a lot of the stuff, and I'm hoping we can just go through, and if people have kind of a lot of discussions or have pretty much like questions of how this applies to them or questions about what they've tried, I think that's like a good point, because I know this becomes kind of a hot topic on what is really, the hard part of treating this. So if anybody has any questions or wants to kind of talk stuff through, I think that's probably going to be the most beneficial, just so that we're all kind of on the same page of what's the most beneficial for treating CIPN from a rehab and exercise standpoint.
So, hi, Karyn. Before I let people go ahead and ask questions, I have a couple in the chat that we'll go over before I stop the recording.
Sure.
So we had, how can CIPN impact vision and or hearing?
So because you're working on those peripheral nerves, that's where you just want to kind of take note of that if you're having difficulty with it, because you're thinking of your peripheral nerve function. So, and just how that affects the central nervous system.
Thank you. And then last question in the chat is, what about having a foot slip under a pedal when driving? Do you help with that? Are there exercises for helping with that?
So a lot of that is just going to come down to that sensation, right? So, our biggest concern, you can either have like that numbness, tingling, burning. All of those are going to be like your peripheral nerve symptoms. So some people have that hypersensitivity. Some people would have like more of like a numbness feeling. So what we would look at in that standpoint would be a couple different things. So obviously, I think that can come from that, because if you don't have that same mobility of the foot, or you don't really, it's no different than like not being able to feel the floor or the surface that you're on. So you might have that sensation that's dulled or hypersensitive, where you feel like you're stepping firmly on the pedal. So what we look at, and that's where like looking at each person, like somebody might come into PT and say, my biggest concern is my foot slipping off the pedal. Or like kind of when I went through the patient example, hers was like, I want to put normal shoes on. So each person, and I think that's kind of what we talked about in the beginning too, is each person's experience is going to be different. So what we would look at a person like that is look at overall strength, look at flexibility. Sometimes if your foot doesn't feel the same, you might not move it the same. So looking at like, what's your overall flexibility? Like, do you have, when we're looking at a foot, does your foot go up to neutral, or has your calf gotten really tight? Do you have full mobility pushing your foot down? What's your strength like within that position? So it's looking and starting people out. Sometimes what will start people out is just a lot of like manual work. We might do 15-20 minutes of manual work just to massage that foot, to try to get a little bit more of that like feeling and blood flow and that kind of thing getting back to the foot. and then kind of honing in on that activity, right? So it'd be an activity where you're pushing, so is that a person who might benefit from riding a stationary bike or might benefit from doing some leg press? Is that something where we come up with an activity in a clinic where, you're pushing against resistance into something to kind of mimic that, that gas pedal? So kind of looking at those type of things. And then, I mean, overall, still, even with anybody, with any of our patients with peripheral neuropathy, we always throw in that balance component as well. Just because we know that that is also hugely impacted. And we understand the fall risks and the fracture risks, especially with our oncology patients. So it would probably be like a multi-level and like multi-step process, depending on where somebody starts too. So if the weakness is that apparent that the foot is slipping off, is the upper leg weak? Has the person become deconditioned from just general cancer treatment? We forget that the body goes through a lot overall with cancer treatment. So what is somebody's overall like endurance at this point? So is it just the foot? Is it the whole leg? So I think it's kind of looking and breaking that down individually. So I guess the answer to that is long, but the answer is yes. But we kind of break that down kind of in an evaluation standpoint, just to try to pinpoint a little bit better, obviously focusing in on the neuropathy, but then looking at a whole bunch of other factors. There's some age-related norms that we always look at when we're looking at a oncology patient. So taking that patient and looking, just a simple task. We know there's age-related norms for grip strength. Some of that can identify obviously what's going on if your hands are numb. But for the lower extremities, we do like the time up and go test. How quickly do you get from a chair, walk a certain distance, get back down, and then sit in that chair? There's age-related norms that we can compare that to see like, is your overall condition affecting the ability to keep the foot on the pedal along with a neuropathy? A 5 times sit to stand. Are your legs weak and you've lost condition from your cancer treatment as well? So there's a multiple things, but overall, yes, that would be something that we'd address and kind of break it down into seeing what the best treatment plan would be.
Perfect. Thank you. And one last one came in. How do you find neuropathy physical therapists?
So, within our system, I would look, and before, I mean, obviously, like, within our system, we're Rush and certain clinics have a ReVital therapist. So if they're ReVital trained, they know how to treat neuropathy. Obviously, not everybody's close to one of our facilities. So I would just question, like, do your therapists have experience treating oncology patients? Because there's a difference in level of what training we get, I guess, in understanding the whole process and knowing, to evaluate if somebody comes in, they're like, I think I've had neuropathy, questioning them and say, well, what chemo agent did you take? Or what was given to you? And being able to look to see, is that an agent that could cause neuropathy? So I would say most of the time I would refer back. I would, kind of even, I mean, I don't know if you guys have ideas of where there are other like oncology rehab. I'm sure some of the other hospitals have oncology trained therapists. So I would, like, prior to making an appointment, just ask the person's just general overall comfort level with kind of treating that oncology population, because it's different than just treating our regular orthopedic population. And I treat both, so I know there's the difference. So I would just kind of inquire as you're scheduling, refer back to cancer centers, refer back to your oncology team. Depending on what hospital system you're treating, they might know within their system if there's an oncology trained physical therapist. So that's kind of where I would start with. And by all means, like I can share information. So if there is anything that you have questions on, whether like we have a location that's close to you or any of that type of stuff, Lisa and the center always have our contact, and we'd be happy to help you find something that's convenient for you.
Wonderful. Yeah, that's tough. Oncology specialized physical therapy.
It's tough. It's tough to find. Even I know I'm lymphedema certified as well, and I know that's sometimes even difficult to find. So it's just I would just kind of question when you're going and ask what's the therapist's comfort level with treating the oncology patient. Or everything, like usually what I say is for people to kind of refer back to your oncology care team. Because they may have somebody, they're like, okay, I know this patient is this therapist has always treated my whatever patient. So I think that's typically, there's not like an oncologytherapist.com or anything like that that I know of. Unfortunately. So
We had another question come in. Do you have any recommendations for improvement in just the toes? We worked with a PT for lower extremity therapy for my mom, but what is left after insurance discharge her is just her toes. Range of motion or strengthening. Doing acupuncture currently also, but really trying to improve the residual symptoms.
So I would like for toes, I would really do a lot of that like self massage, the tactile. Like I feel like that tactile of just massaging the toes, stretching the toes. Same type of thing. Like you have to like if you think of your interconnections, so like your calf muscle goes and connects down into your foot. So if the toes are real numb or tight, making sure you're doing some of that calf stretching is always important. Even for tactile, because you think of all the little muscles that are in your feet. So you want to work a little bit of strengthening, tactile, and something that's great would be like crunching a towel. So you're getting that tactile of like crunching your toes with a towel. And that's going to be good feedback because your body's going to feel that feedback of like touching the towel. So that would be a good one. Anything sounds kind of crazy, but we've had people try to pick up marbles. So if you think of your toes being numb, something that seems like a silly task that somebody can do, is going to be really difficult if you can't feel your toes. So anything like that where you're grasping at marbles, if you think of your walking pattern, you hit with your heel, you push off through your toes. So anything to keep that calf stretched is good. And then I think just manually sitting there and massaging those toes just to try to keep blood flow, even manually, kind of like you'd stretch your fingers, stretch those toes both directions, crunch them down manually just with your hands, like if you have the dexterity to cross your leg. I don't know if the person has that mobility or, sometimes people can't reach their toes because of hip or knee injuries, but just anything you can to kind of move those toes back and forth. Kind of like, stretching them that way. Somebody could sit in a chair and, keep your foot on the ground and then just stretch your toes up. Kind of like if you're going to go up onto your toes with your, like if you're sitting on the floor with your feet flat on the floor and then going up onto your toes, that can stretch the toes out a little bit. But a lot of that tactile. And I think something like a marbles, or like picking up marbles or picking up a towel, would be a great activity. And then obviously balance, but again, depending on balance, depending on somebody's baseline, if somebody's balance is really off, we don't always necessarily start them balancing at home by themselves just for safety reasons, right? So, that's kind of an individualized one that depending on how somebody's balance is, if they're real unsteady and a really high fall risk, we're not going to have them stand at a kitchen counter and hold on and try to balance on one foot because obviously you could fall. So that might not be an unsupervised activity at first, but that might be something we'd progress to. So I hope that helped.
Well, it did actually, because she wrote back saying she is a PTA and knows exactly what you were talking about. And this is exactly what she's been having her mom do. So thank you.
Good job.
Yep, good job. All right, next question. Since chemo 2017, have noticed just toe tingling numbness in bed or sitting, not walking around. Is there any, is, oops, sorry. Is there anything that I can do to prevent this from getting worse?
So it's both feet though, right?
Toe tingling numbness, I'm assuming both feet, while in bed or sitting, not walking.
Okay. I would just say just general mobility, dexterity, and balance. And obviously, like, here's the good thing. Good shoes, and if it doesn't hurt while walking, I would keep good shoes on and keep active. And I think that's the best advice for that one. Obviously, I think good footwear when your foot's on the ground to prevent it from getting any worse. And always I would say as well, don't downplay just going somewhere and being like fit for a pair of shoes. Making sure you're going somewhere, I mean, it's tempting sometimes if you're gonna want to just go and, get a pair of shoes off the rack at Dick's or whatever, but I'd invest in a good pair of shoes. And making sure that you're going somewhere where somebody is fitting you. But I would just say keep moving. And then because it is kind of that at rest, just really kind of massaging those toes while at rest, I think can help. But I would say keep moving, keep stretching, keep staying strong. And that's the best thing you can do from trying to prevent it from getting worse.
All right. Next question. Chiropractors and naturopath focus on nerves. Any opinion on success of using them? I keep seeing ads for Dr. Horn, who promotes I think it's neuropathy treatment. Any thoughts?
So different. So if we're looking at nerves, remember, these are our peripheral nerves. So they're different than the nerves that would be like a pinched nerve in your neck or a pinched nerve in your back. When you have that pinched nerve in your back, it's typically going to affect more one side versus two. I know there's a lot of stuff out there that people will say like infrared or different types of stuff like that that's targeted to treat neuropathy. Um, you might know somebody who does it and they're like, okay, I feel great. Unfortunately, like in the realm that we look at is we look at a lot of just different outcomes and studies. So some of that stuff as far as like the infrareds or the different things that are slated towards treating neuropathies, they don't have a lot of evidence-based research behind them. So that's the hard part, is that there might be stuff out there. I'm not saying that they don't work at all. I'm just saying that the evidence doesn't support them being an effective treatment. So there's been a lot more research and a lot more focus, and a lot more articles recognizing rehab and exercise and that role in the oncology population. And so that's where a lot more of the valid research comes from. So again, not knowing exactly what, but just remembering that there could be neuropathy that's based from like more like a disc problem or arthritis in the spine. And I know sometimes chiropractic will get a little bit more into that. And I know sometimes they have their like neurop come for like, an infrared boot or whatever. But you have to just remember that there's neuropathy pinched nerve, and then there's peripheral neuropathy that's affecting those nerves a little bit differently, and remembering that that's something that affects bilateral. So it's going to be both hands, both feet, not just one side.
All right, they keep coming, Karen. Here's another
Okay.
one.
This is good though.
Yeah, right. Let's see. What about when you also have bad circulation in your leg or legs?
Okay, so that would be, okay, so what I would say if a patient came in and said, I have bad circulation, who have you talked to? So who on your oncology team, or are you following with a vascular surgeon? Was this something that you had prior to treatment? So kind of like going through that whole step of understanding, like, did you have vascular issues prior? And then looking at that, are you having vascular issues? What do your legs look like? Does that need to be treated differently? So looking at, like, a lot of times my patients, and this is coming at it from more of like my lymphedema standpoint, is it the vascular that's causing it? Have you always had it and never had a problem with it? So is it the vascular that's causing problems, or is it really truly the peripheral neuropathy, or are they both playing a role? So that would be where we'd look at that individualized. And then is that something where if are you developing swelling, or have you been looked at by somebody to assess the vascular system? So that might be a discussion with the oncology team. If you think it's worsening, has something changed within your system? Is that something that needs to get controlled with wearing appropriate compression hose? And then that will help the circulation aspect. And then that allows you to be more active and, stretch and train and balance because your legs feel more energized because you're wearing compression. But I would say that would be like definitely a situation where the person would need to be effectively assessed. And then figure out, what's the root of the problem? Who have they been evaluated by? What tests and measures, et cetera? What was the status before chemo to where it is now? And kind of breaking that down a lot more in depth, I would say.
Thank you. So next question, what is your opinion of using acupuncture?
I think same thing like anything. I think there's a lot of good use for it from an integrative medicine standpoint. It's not my area of specialty, but I know we have a lot of patients who do acupuncture and integrative medicine type things. Some of that stuff, again, is going to fall in the realm of, where's the research on it? But I think with, again, the right trained individual who's used to treating an oncology population, and I think that's the key, is always making sure your person is oncology trained. I think that's another one of those that's kind of a tricky line. But definitely have patients who use acupuncture and other things to try to control pain. So I do believe there's some validity in it, but yeah, the research might not necessarily 100% support it, but I know there is a lot of it used in the integrative medicine standpoint. I think people like to try stuff that's different, that's not necessarily thinking about taking another drug. So.
Okay, thank you. So this is more of a comment. With my neuropathies, I had such pain getting my feet into shoes. I found shoes with zippers on each side that opens up the shoes wider so I can slip my foot in. Then once the foot is in, you zip them back up. Not cheap, but very, very comfortable.
I think that's fabulous. I think anything like that, or, just watching, like we said before in the lecture, like looking at like Velcro. So if you have a day where, as long as your shoe is staying on stable on your feet, you don't want to get in those habits of like not tying your shoelaces or tying them too loose to where then your heel's slipping out of your foot. So I think if you found, like, again, a shoe that stays stable on your feet, that's the key. Because again, that's the hard part. Like I was saying with the one patient, she could only put flip-flops on when she first started. And we all know it's not very efficient to walk around in Chicago in flip-flops in December, so anything like that. I mean, again, not cheap, but your feet are worth it. And I think that's a great thing to share with other people, because people don't sometimes know that stuff exists out there. So whether it's Velcro or like the two zippers on the side, as long as it's staying stable on the feet, I think that's fantastic.
All right. Is there evidence that compression garments can be helpful?
Not necessarily for like the neuropathy standpoint, but again, when we're looking at like the complexity of it, is somebody else having like a different complexity problem, you know? So I think we talked about the person who, um, might have had poor circulation, and looking at that, there's definitely things we can look at, um, that kind of hone you in. Like if people have decreased circulation, they're going to have like a little bit of redness at the lower part of their leg. That might be a person who will benefit more from that because then their legs feel more energized. But again, it's kind of one of those things too, you have to be careful of because there's good compression and bad compression. My biggest risk with just telling somebody to go get some compression, um, is that you also have to, anything you have to be careful with, right? So if you do have that hypersensitivity or numbness on your foot, you have to make sure you're getting into the right like grade of compression. So there's different grades. It's graded kind of like you would grade the pressure from a blood pressure cuff. Is how they, so it's 15 to 20, 20 to 30, 30 to 40 are the compression grades. And so you'd want to be careful if somebody is having numbness, that they're not going into something that could tourniquet or roll and they're not going to feel it. That would be kind of my concern. And then knowing that each compression garment isn't the same. Definitely same thing with a shoe. You'd want to go to a place that fits people with compression. I'm super cautious of telling people to just go to like if you think of it this way, so like going to like a Walmart, because people will come in, and this is more like my lymphedema side note, but people will come in and they'll have bags and bags and bags of different types of compression. And what always is amazing is like you can go to a Walmart and people will want to get like, okay, they were cheap at Walmart, they were cheap at Walgreens, so I bought these compression hose. Always err on the side of caution of buying compression hose that's sized according to shoe size. Because all of us on this call might have the same size shoe. We might all wear a size 8, but somebody might be 5'10", somebody might be 5'2". So if you think of it, somebody might be 105 pounds, somebody might be 160 pounds. We all should not then, even though we wear a size 8, wear the same size compression, because it's going to come up too high on one person who's 5'2". It's going to be too short potentially on the person who's 5'8". It's going to be loose on the person who's 105 pounds, and it's going to be tight on the person who's 160. So, just always err on caution of just getting into the compression that is just sold by shoe size. That's just my sidebar note. But my only concern with kind of generalizing compression garments would be that you just need to make sure they're fit. And if you are somebody who has a lot of numbness, we just want to be careful of putting you into something that you would not know is binding, because that's where we're getting into the risk of, wounds or, stuff that irritation to the foot, etc. So again, kind of individualized, but it's depending on what we're trying to treat.
All right. This person said acupuncture, good question. Just asked. Makes me curious since they did that to my feet during chemo, and now I wonder if that prevented me from having worse problem. So it could help now. I don't know if you want to add anything to that, Karyn. That is our last question on the chat.
Okay. I mean, again, I think there's a lot of stuff out there, and I know acupuncture comes where they're doing it more in the integrative medicine. So I think that's like a fabulous, and I think it's good when the people share their other like share about the shoes, share different things, because that's how people learn stuff as well. And I know this is kind of a tough topic, and again, everybody's symptoms on this call might be totally different. There could be somebody on the call who only has hand symptoms, and that's different than having feet symptoms, but it's still debilitating when you're looking at your ADLs and like what you could do, just in general in life. So, I think that's tough, but just know there's stuff out there that can be done, to try to just control the symptoms at that point too.
Thank you, Karyn. Since that was the last question.